I'm Paul Bernstein. I'm a clinician scientist at the Moran Eye Center, specializing in inherited retina diseases and age-related macular degeneration. We doing retina surgery are working on some of the smallest parts of the body. The macula is only a couple millimeters across and less than a millimeter thick. We're pushing the limits of what surgeons can do. And moving too far can cause damage to the retina that is permanent. That's where robots come in.
I was exposed to a lot of technologies that are used in the micro nano world. And I started thinking that some of these actuators that are used to manipulate objects under scanning electron microscopes are actually very well suited for eye surgery applications. I approached the Moran Eye Center and started working with Paul Bernstein. There was no convincing. He was on board from day one.
I knew that robotic surgery was coming, and I could use his help and his insights to get us to the next step. When they realized that patients are awake during surgery, and they sometimes move and sometimes snore. Even a small amount of movement can cause severe damage to the retina. So they realized that there is a second part of the equation that others who are studying robotic surgery had not considered when it comes to retina surgery. To compensate for patients' movements, we have developed a helmet that the patient wears.
You've got this helmet that's form-fit tightly to the head. The robot is mounted to that helmet. And so now you have these three things all moving together through space. The robot on the helmet on the head, and they're moving together. The goal has always been to basically make a surgeon have superhuman hands.
And using a robotic device where I'm using a joystick, but it's using the same instruments that I would normally use in my hand, it is compensating both for what I do and what the patient is doing. That is a very exciting new frontier in robotic surgery.
We haven't taken any control away from the surgeons at all. They're still completely in control of the tool. It just will be easier for them to do the job they're trying to do.
And these collaborations are just wonderful at the University of Utah. When I have ideas, the engineers, the chemists, the physicists are just a few blocks away.
There aren't really that many places in the world that can do medical robotics research. First of all, you have to have a high-level robotics program, and then you have to have basically a medical school and a research hospital. Ideally, those things would be close enough that you can actually collaborate on a regular basis. And so the University of Utah is one of these kind of special, magical places where medical robotics research can thrive.
I am very excited to be working with Dr. Abbott and his group developing robotic retina surgery. I think it will be fantastic.